All right, everyone, good morning and welcome into Mid-Morning. Dr. Keith Watson is joining me in studio. And Dr. Watson, guess what? This is our last segment of 2025.
I know, that is hard to believe.
Yeah, I feel like 2025 just started, but it's really flown by. And I just want to say, guys, apparently me and Dr. Watson's got some good traction from our last segment of the theory, so that will be a reoccurring thing here on the station.
The urban legends of medicine.
Truly. I mean, it was a very interesting one. Okay, so Dr. Watson, I've got a few things for you. So obviously we're going into 2026. I know for a lot of older adults, or you think about things you want to do in the new year, but it made me think about families. So what are some health resolutions for families that are actually realistic that you could recommend that your patients or even our viewers could do into 2026?
Well, I guess it would depend upon what the health concern was.
Okay.
Say, for example, eating healthier. It's an easy one to do.
Yeah.
Cut out some of the fast food and the junk food. Exercise together.
Yes. Oh, that's a good one.
Now, granted, it needs to be a little warmer than today to do that, but exercise together every afternoon, evening, after school, after work, everybody's home. Walk.
Okay.
Go somewhere and walk for 20 or 30 minutes.
And it's also kind of adding some family time right there, too.
Well, sure. The American Academy of Pediatrics recommends that children get an hour of exercise a day. So if that hour, and now that doesn't mean necessarily you have to go to the gym and lift weights, but an hour of exercise. If you took that hour and you all went together when the weather's nice enough and just walked as a family, that's family time. It's de-stressing time.
Okay.
Because you get outside and get a little fresh air and you can exercise a little bit. So some realistic things like that from a health standpoint would be maybe just eating better and exercising a little bit. And that's something you can do as a family.
Yes. And whenever it comes to eating better, do you recommend that everything maybe the parent is doing to eat better, the child should be consuming as well? Or, we're just going to throw a little more veggies here, do a little more fruits here, a little less juice boxes?
Yeah. Simple things like that are easy to do. Children are different than adults.
Okay.
If I'm 10 pounds overweight this year and I do nothing and I go to my doctor next year, I'm still 10 pounds overweight.
Okay.
But if a child, in a year's time, they grow. They grow taller. If they don't gain any weight, that 10 pounds that they were overweight suddenly is not 10 pounds overweight anymore because they've grown taller and some of that weight gets redistributed.
Okay.
So with children, they're still growing. They have to eat. Typically putting children on diet is not something you do unless it's an extreme circumstance.
Okay.
So children can eat and should eat. You just cut out what we call those empty hidden calories.
Okay, yeah.
The sugars, the sodas, the oatmeal cream pies, those kinds of things that everybody loves.
Yeah.
Eating a little healthier and cutting out the sugars in the sodas and the juices and drinking more water. Those are simple little things that can make a huge difference.
And that the whole family can do. All right, so my next question is, what should parents schedule in the new year?
Every child should have an annual well child check. Okay. You should see I have to see my doctor every year. He gets my height and my weight. He takes my blood pressure. He makes sure I'm eating right. I'm getting enough sleep. I'm exercising. I'm doing the things at 53 years old that I'm supposed to be doing. Children are the same thing. Okay. You should have a checkup every year. We want to check their growth, their development, make sure, especially the younger kids, we want to make sure they're meeting their milestones, not only from a growth and development standpoint, but from a social standpoint. Okay. We want to make sure, even as pediatricians, we want to make sure that they're doing okay in school, that there's no issues going on there, that educationally they're meeting those milestones. So some kids need shots to go back to school. Okay. So that periodically occurs as you enter kindergarten, as you go into the 7th grade. So getting a checkup schedule with your doctor for your child, just to make sure overall they're healthy and meeting the milestones they're supposed to.
And this will help the parents kind of keep track with everything too as well.
Absolutely.
And then I guess as a pediatrician, what is the biggest red flags parents might seem to miss when it comes to their kids?
Oh, this one's, I had to think about this one when you asked me. Stay involved in your kids' lives. Okay. Check their phones. Okay. See what they're looking at on the internet on their phones. See who they're talking to. Stay involved in your children's lives so that you can guide them to make right, smart decisions. Yes, teenagers, they're getting older, they want to be independent, but you're still their parent.
Okay.
You're not their best friend. You can be their best friend, but you're their parent, and you need to stay involved with what their eyes and ears are seeing and hearing on social media and the internet, because not everything that's out there is good for a kid.
Good information right there. Well, guys, stick around. We've got more coming up after the break. All right, guys, welcome back. So Dr. Watson is in studio with me. So before we went to break, we were answering a few questions I had for him, but I want to talk about this because I've seen it all since the Christmas holidays. The flu cases seeming to be at a spike since all the gatherings have happened. What would you recommend for parents to do in this time if their child is not yet sick from the flu?
Do what you can, which unfortunately, this is the holidays. You're going to be meeting and greeting. Young children especially infants, stay away from large crowds. Okay. Don't go to the malls.
Cancel those NYE celebrations.
Yeah, don't go to the malls. Don't get out in public. Stay away from large groups of people, especially enclosed areas types of things. Yes, family's going to get together and you've got young children. Wash hands. If you're sick and you don't know whether you have the flu or not, if you're sick, don't go to family gatherings and spread those kinds of things around.
And then if for a parent, if they have like a toddler or something, if they happen to contract the flu, do you just try not to be around the toddler, which I know that's a hard thing to do? Like, how does that usually work?
That's
as a pediatrician.
Yeah, that's a tough. You have to tell the parents. Try to minimize close exposure. Now, that's easier for a dad than a mom. Obviously, given our roles as parents. But wash hands. It sounds so simple and so cliche, but washing hands dramatically reduces the spread of infections. If you have to sneeze or cough, you cough or sneeze into your elbow rather than onto your hands. You wash your hands after you touch things and try to stay out of real close face-to-face contact. Simple little things like that. It will never put the risk at zero, but it will dramatically reduce the risk.
And then I know a few months ago it was time to get your flu shot. Can you still get a flu shot at this time, and will it still work?
Flu shot will still work. You're still going to be in flu season through probably at least into February, 1st of March. So a flu vaccine in December is still going to protect you from this point on. Keep in mind, though, the vaccine takes about 30 days to reach full effect.
Oh, I did not know that.
So if you get the vaccine now, you're still susceptible to catching the flu till probably mid to late January. That's where the old, speaking urban legends, people say, well, I got the flu shot and then I got the flu. You didn't get the flu from the flu shot. You got the flu shot. You got exposed to the flu before the vaccine went into effect.
All right, there. Guys, if you have any questions for Dr. Watson, you can go visit him in West Point. We'll be right back after the break.